Sales of emergency contraceptives spiked in the days following last week's election, according to data compiled by our CBS News Confirmed team. Winx Health, a sexual health company, reported a 966% increase in the sale of its morning after pill in the 60 hours following the election compared to the week before. President-elect Donald Trump has boasted about his role in overturning Roe v. Wade, the landmark Supreme Court case that protected the right to abortions. In May, Trump said he would consider restricting access to birth control. He later walked back that comment. Dr. Jessica Shepard joins us now. She is a gynecologist and founder of Modern Menno Health. Doctor, thank you for being here. What should people know about emergency contraceptives such as the morning after pill? Do they expire if people are stockpiling them? Is there a concern that patients doing so could use them incorrectly?
Well, let's start first with the concern, and I think rightedly so that women should be concerned about their reproductive health, especially as we're starting with the new administration. And as you mentioned, we have seen that there has been boasting of, again, bringing down the reproductive or bringing in, Supreme Court justices that actually did give us where we are now with states that actually have abortion bans. So being in one of those states myself, I do see on a personal level this concern and how people are increasing the awareness of what they need to do if something were to happen and they needed to make a decision.
We're also seeing a spike in doctor's appointments for long-acting reversible birth control. Planned Parenthood reported a 760% increase for appointments for intrauterine devices or IUDs on November 6th, the day after the election. What long-term birth control options are there? What should people know about them?
Yeah, I think that's a great question. So the more that people know that they can make better decisions for themselves. When we look at long-term acting contraception, these are types of contraception that are actually going to be the best ones that are going to be preventing pregnancy because they last for a long amount of time, anywhere from 3 years to as much as 10 years. So when we think of the intrauterine device, this is going to be something that's being placed by a physician in the office, but again, can last for up to 10 years. And if someone wants to take it out prior to that, they can. So these are the types of things that we really should be shifting the information to, is not so much on where we can and cannot get an abortion, but also what are the things that we can do right now that are going to be kind of in a way positive for people to say that I am protected and I do not have to have the worry considering what state that I live in.
What are the most important questions women who are worried about their reproductive health should ask their doctor?
Absolutely. The imperative things that they should be asking are, for me as an individual, what are the options that I have? And also, abortion is not illegal in some states, and knowing exactly where you live and what the actual laws are for that state. I would think that that is probably the most important thing, because in a time of crisis or in a time of need, it's absolutely imperative based on time where you can go and what services that you can get. And last but not least is making sure that we advocate for other people that we know in our communities and making sure that they're getting the help that they need, because we do not want people to, again, miss that time frame of care that they can get and find themselves in a dire situation.
Dr. Jessica Shepard, thank you so much.
Thank you.